In this presentation, I would like to look more deeply into three different approaches to sex therapy, namely Masters and Johnson's sensate focus approach, Dr. David Schnarch's crucible approach, and contrast these two against the standard medicalized approach. Dr. William H. Masters and Virginia E. Johnson published their seminal work, Human Sexual Inadequacy, in the 1970s, thereby literally creating the field of sex therapy. As a result of their findings, they developed the human sexual response cycle. This has been the standard backdrop against which sexual dysfunction is defined. Over the years, Masters and Johnson have modified and amended their original work to reflect increases in understanding. Dr. David Schnarch's crucible approach posits that committed relationships naturally formulate a crucible-like environment, which is ideal for personal growth and maturity. Working within this system, the crucible approach proposes differentiation as the process whereby sexual fulfillment can occur. Differentiation, in simplest terms, is the lifelong process of becoming a self in relationship. The more differentiated an individual is, the greater their capacity for meeting their highest sexual potential. And finally, the medical model sees sex as a biological function, and since medical practitioners' expertise lies in anatomy and physiology, naturally their diagnoses reflect this physical aspect of sexual dysfunction. Thus, treatment emphasizes symptom reduction as the main goal. Sensate focus, crucible, and medical all adhere to the basic principle that sex is a natural biological function. While at first, this statement, first promulgated by Masters and Johnson, seemed to be liberating and give sex therapy scientific credibility, its long-term effects may have had a more negative side effect on the general public. By claiming that sex is a natural function, this can lead people to believe that if they are having trouble sexually, then something must be wrong with them. Or even if their expectations regarding sexual performance does not line up with current social and cultural expectations, then pathology, or at the very least dysfunction, is suspected. However, as Dr. David Schnarch asserts, the sex that comes naturally is reproductive sex. Intimate sex, however, is a learned ability and an acquired taste. The medical model, fully embracing the sex as natural function, tends to treat the body as if it were separate from all other aspects of being, such as the mind and emotions. Not always, but predominantly. And that pull towards dealing with sexual problems as if they are somehow separate from the rest of our lives is irresistible, as Hertlein says in her book, Systemic Sex Therapy. Talking about sex makes people uncomfortable. Even the majority of medical students in the United States and Canada are uncomfortable talking about sex with their patients. A research article on sexual communication further illustrates this discomfort, showing that for both clients and therapists, the topic of sex and sexuality can be embarrassing or awkward. This discomfort leads people to distance themselves from the issue. If sexual dysfunction is only due to a medical issue completely fixable with a drug, then that removes any need for self-reflection or dealing with issues of intimacy or communication between couples and cognition in the self. Instead, the focus of treatment is firmly placed on the symptoms of the presenting patient. And in contrast to the medical approach, sensate focus shifts to the relationship as the target of treatment instead of the symptomatic patient. Sensate focus sees the sexual problem as having to do with both partners in a relationship. Similarly, the crucible approach developed by Dr. David Schnarch targets the relationship as the focus of treatment. Sexual dysfunction can only properly be understood within the context of the relationship. In fact, Dr. David Schnarch asserts that every couple needs to understand that what they do in bed is a remarkably salient and authentic expression of themselves and their feeling for each other. However, despite increases in understanding, such as the intersystem approach to sex therapy and its more holistic focus, The medical model does continue to prevail and spread ad campaigns targeted toward the general public and affirming this false presupposition that sexual difficulties can be cured with the proper medicine, and consequently leaves most feeling no need, maybe, for self-confrontation or insight. It is noteworthy, Heartline states, that with each new biomedical intervention, the target of treatment was the symptom of the identified patient, rather than on the system in which the difficulty was generated, situated, and came to be perceived as problematic, thus marking a complete reversal of Masters and Johnson's original formulation of the nature and focus of sex therapy. Some goals for sensate focus. Couples need to work together, firstly. This promotes physical closeness and positive touch to increase intimacy, alleviates stress and pressure with performance anxiety related to intercourse. And number 2, attention to that physical sensation. The focus is placed on the feelings and sensations of each partner, not performance. The goal is to experience each other's bodies. Self-awareness of feelings and sensations are critical. And then 3, mindfulness. The goal is to get in touch with the senses, to be present in the moment. This reduces spectatoring and gets at the self. The point is to stay in the here and now. And some goals for the crucible approach. Firstly, the client must be the one to identify the problem. This honors and respects each person's autonomy and allows the clients the opportunity to self-reflect. 2, you must construct the crucible, which is that relationship which therapists assist the couples in building this critical mass for change, this environment that is ripe for change. Building critical mass for change is a different way of approaching periods of difficulty and change. Rather than avoid or view them as negative, the crucible approach encourages couples to view these periods as opportunities for building and maintaining effective cognitive function and emotional regulation during increased stress and emotional arousal. The 4 points of balance are integral in the understanding and utilization of the crucible approach. The 4 points of balance are: point number 1, solid, flexible self. This is the ability to maintain a solid sense of self rather than depending upon a positive, reflected sense of self from others, allowing you to maintain your own psychological shape when other people pressure you to conform. Likewise, it reflects the ability to change and adapt, accept influence from others as good judgment dictates, and heed good advice without losing sight of your own goals and values. Point 2, quiet mind and calm heart. This involves the capacity to soothe your own feelings, regulate powerful emotions, control your anxieties rather than maintaining emotional balance by either dominating or accommodating others, or by becoming emotionally distant or intrusive. According to the crucible approach, people who cannot control themselves control the people around them. Number 3, grounded responding. This is the ability to make modulated, proportionate responses to provocations and difficult circumstances. This means not locking into arguments or overreacting, while also staying emotionally invested and not avoiding difficult people or situations that need to be handled. Number 4, meaningful endurance. This is the ability to get out of your comfort zone, tolerate discomfort for growth, and persevere through disappointment and hardship to accomplish your goals. It is also knowing when your efforts are foolhardy and it is time to give up. Thirdly, identifying appropriate interventions. Depending on the needs and desires of the couple, Dr. Schnarch identified some exercises that may be helpful, including hugging until relaxed, heads on pillows, feeling while touching, eyes open kissing, and eyes open sex and orgasm. Continuing on, detriangulate as necessary. The relationship between the therapist and the couple, the goal is to consistently bring the focus back to the couple, The therapist must not allow the client to attempt to ease its tension by drawing the therapist into the conflict. Also, holding that crucible means assisting with differentiation and intimacy. It is through the relationship that people develop the ability to be intimate. The stronger your 4 points of balance, the more differentiated you are. And perhaps the most well-known maxim of the crucible approach is that marriage is a people-growing machine. And the ultimate goal that is conceptualized by Dr. David Schnarch is that of self-actualization of the individual in relationship, or differentiate. Goals for the medical model are obviously health and wellness for the patient. The priorities then become: first, identify the dysfunction. The presenting patient discloses the problem, and the primary focus of the physician is then to assess for any underlying physical causes through thorough physical examination. Finally, treating the symptom is the main goal of the medical model. The appropriate utilization of medication is typically a first approach in conjunction with referrals for therapy and lifestyle changes. How change occurs via the sensate model. Utilizing sensate focus as prescribed is meant to circumnavigate problem areas by intentionally avoiding situations and activities with a high potential for failure. For example, trying to make your partner feel good has a high probability for failure. Likewise, trying to make your partner orgasm. But touching your partner and focusing on what that feels like is almost impossible to fail at, since the whole purpose of the exercise is merely to pay attention to what you're feeling. Change occurs by shifting your locus of control away from that which you manifestly do not have control over and toward areas that lie firmly within your control. Sensate focus and mindfulness go hand in hand in that both attempt to teach people how to pay attention and stay in the present moment. For those who struggle with control and performance anxiety, this approach may alleviate anxiety by giving the mind something else to focus on. Sensate focus is a clear, tangible way to learn by doing. And it is a chance to be successful with homework assignments that may serve as a boost to self-confidence and a lowering of anxieties. The crucible approach, change occurs through the acceptance and appreciation of the normalcy of the experience of emotional gridlock. When couples face an issue, for example, sexual desire discrepancies, and cannot agree to disagree, nor can they reach a compromise, rather than see this as a negative, Dr. David Schnarch urges couples to view this process as normal and even beneficial, as it aids in the solidifying of self and the strengthening of the couple relationship. Being able to tolerate discomfort and not try to transfer your problems onto someone else is a sign of personal emotional maturity and key in development and growth. Change occurs when each partner is able to identify what they want and also to balance that with the needs of their partner and come together in mutually beneficial ways. For the medical model, change is determined by the alleviation of symptoms or the discontinuance of the problem. For example, if the presenting issue was the inability to sustain an erection and the prescribed medication helped the individual maintain an erection to completion, then change would be pronounced and successful treatment achieved. If the medication was not successful, then some tweaking and changing of medications would ensue up to a point when the medical practitioner had exhausted the available medications, at which point the patient would most likely be referred to either another specialist or a therapist. Some theory-specific interventions, for example, in sensate focus, the preferred form of therapy is short-term intensive with different phases. Phase 1, which negates any genital contact, and phase 2, which allows for the sequential introduction of different forms of genital contact. This here and now approach refers to the attention paid to the present moment and sensations. Also, a focus on radical self-responsibility, which means that each individual in the relationship is asked to focus their effort for change directly on themselves and their experience. In the Crucible approach, they introduce the concept of differentiation in terms of sexual identity and in relationship. Emotional gridlock is another term, confronting differences, as well as the 4 points of balance. Essentially, all interventions within the Crucible approach are aimed at raising levels of differentiation. And the medical model specifically prescribes medication as a treatment option for problems and dysfunctions, along with healthy habits, including eating, rest, exercise, lifestyle change. Masters and Johnson envisioned ideally that short-term intensive focus for their therapy model, which is meant to build up the sexual tension or use that to their advantage. Sensate Focus was originally conceptualized as a 14-day intensive model, including laboratory testing, medical exams, and history taking. Following this was the feedback session called a roundtable session, and then regular processing of the therapeutic suggestions. It's important to note many therapists today will modify this original method to fit a once-weekly session schedule. And the phases, which were already gone over, proceed in a sort of hierarchy, gradually becoming more and more intimate and sexual in nature. The Crucible approach treatment plan includes working with the couple to identify the issue, and throughout the process, reframing and mirroring helps the clients understand their role in bringing about positive change in their relationship in new ways. Focus is placed on getting clients to appreciate the benefit of doing the work to resolve differences. It's important to recognize that difficulty in facing differences is part of being in a committed relationship. Going through that crucible is what ultimately has the potential to aid in growth and to aid in personal differentiation. This process is akin to post-traumatic growth. Going through and dealing with particularly difficult and uncomfortable situations creates a pressure cooker situation that has the potential for creating something new and beautiful out of old self-constructs. It's important to acknowledge the benefit that modern medicine brings to the issue of sexual dysfunction. A thorough medical exam should be considered best practice. Primary care physicians tend to be the first person a client will divulge their issue to. And from there, the physician will make appropriate referrals to specialists, for example, internists, geriatricians, urologists, endocrinologists, and cardiologists, depending upon the presenting problem. It's important to have the medical exam done to determine whether any underlying medical issue is compounding or masking the presenting sexual difficulty. For example, some underlying medical conditions for men could be hypertension, hormonal imbalance, diabetes, or cardiovascular disease. For women, also cardiovascular disease, hormonal suppression due to lactation, menopause, low testosterone in postmenopause, and metabolic syndrome, just to name a few. Also, there are some neurologic disorders like multiple sclerosis or Parkinson's. And so having determined whether the issue is physiological or not directs the course of treatment. The first line of treatment generally includes recommendations for changes in lifestyle, for example, quitting smoking. Second line of treatment includes prescription drug treatment, including very common and well-known PDE5 inhibitors, Viagra, or even the controversial sildenafil, which for women. If the problem is hormonal, then replacement therapies are recommended, i.e. testosterone replacement therapy, and sex therapy is also frequently recommended. Some major limits of sensate focus occur around interpretation. Much of the original literature has been misconstrued and misinterpreted, resulting in confusion regarding practice. Another limitation is if the clients do not follow the process. The use of exercises or homework has the potential ramification that clients remain on the surface of an issue rather than delving deeper into underlying causes or concerns. Some major limits of the Crucible approach center on expectations. The presupposition behind the process is that mind-blowing, transcendent sex is achievable for all committed couples. It's tempering to note that mind-blowing out-of-body experiences may not be realistic or even a high priority for many couples. Accepting that contentment or happiness of the couple should be the primary goal may go a long way towards alleviating sexual distress and the undue stress expectation itself plays on individual sexual experience. And the major limits of the medical model result from a disconnect between the mind and the body. Viewing the body merely as a machine that requires fixing when broken is limiting because it does not address the complete picture of what it means to be a human being and the complex ways the mind and the body interact and influence one another. I see myself finally as someone open to whatever method or therapy works for the particular clients. However, the method I myself am most drawn to and the one that resonates the most for me personally is the crucible approach. While sensate focus offers tangible means to an end and the medical model may offer a quick fix solution, it is my belief that the crucible approach offers the most holistic and long-lasting method for positive change of the three. If self-actualization is the realization of one's full human potential, then I believe differentiation, as Dr. Schnarch envisioned it, is the self-actualization process of a couple and the height of what is possible. Reaching one's sexual potential has the power to strengthen and empower couples, as well as raising their individual self-confidence and their commitment to one another. That being said, perhaps a better definition of sexual potential is required and should be altered to include all levels of desire and function. Basically, reaching one's sexual potential is a subjective experience and should remain a definition that is worked out within the couple and should be allowed to grow and change depending on circumstances and personal choice. I just liked this quote from Dr. David Schnarch: a solid sense of self develops from confronting yourself, challenging yourself to do what's right, and earning your own self-respect. And then my references. Thank you.